Hello, my name is Caitlin, and today my project is basically about mental health trauma in children and adults, and mostly is about mostly adverse childhood experience. So I might guide you through how it works and why it's important. So let's get started. So what is adverse childhood experience? Adverse childhood experiences, or ACE, are experiences of abuse and neglect or other household problems occurring before age 18, and it contributes to the development of both physical and mental health concerns. There are also research that exists regarding how childhood experiences homelessness interact with ACE. In most mental health outcomes, how it is conducted, and most reports show that disproportionately higher rates are negative mental outcomes. Also, results found that ACEs significantly predict that negative mental health outcomes for people experiencing homelessness, and explains how the effects of the trauma events on children go through negative mental health outcomes. So the background of this is that ACE starts within trauma, which occurs when an individual has experience of actual and threatened deaths and serious injuries or sexual violence, and according to American Psychiatric Association. Also, traumatic events also often expected to have a long-lasting events on individual physical mental health, function as well-being, and may take form in a single experience event. Traumatic events are more common in the United States and more than people may expect, with actually be 61% of men and 51% of women reporting that may have experienced at least one traumatic event in their lifetime, and commonly occurring during childhood. More than two-thirds of children experience at least one traumatic event before the age of 16. And the original ACE framework, which is a childhood experience framework, was originally developed in conjunction with Care Permanent and the Centers of Disease Control and Prevention, and it considers potential traumatic events in childhood to encompass in multiple ways. ACE are experiences of abuse and neglect and other household challenges prior to age 18. The 10 specific traumatic experiences are emotional abuse, physical abuse, sexual abuse, emotional neglect, physical neglect, potential parental separation, and or divorce, witnessing domestic violence, living with a person struggling with alcohol or substance misuse, who was someone who had mental disorder or experiencing a household member who being incarcerated. The method and the materials they use is an artificial data collected by the local nonprofit shelter. Organizations surveyed 100 people experiencing both shelter and no-shelter homelessness, reserving shelter and hygiene access to participants ages from 18 to 60 years old plus. Samples identified that more 60% participants more than female, 40% participants, while the racist participants was white at 60.2%, and while 20% Black and African Americans, meaning that they have been 100% due to discrimination. And materials they use is perform a self-report survey to collect a data of major sections, and with questions asked as a part of larger data collection. They use a questionnaire, which is a 10-item measurement of experience of abuse and household dysfunctions experience when they're prior to age 18. And they propose yes or no questions regarding with experiences with 10 age childhood experiences, and measures a wide range of potential childhood trauma events. So the physical and mental symptoms because adverse childhood experience can manifest in children and adults in physical, emotional, and behavior symptoms like anxiety, depression, like nightmares, sleep difficulties, and trauma-related triggers. Their emotional symptoms is like anxiety, worry, or feeling sad or fearful, or scary thoughts, mood swings, difficult concentrating and clear thinking, difficult trusting others, and attachment issues of fear and abandonment. The behavior issues are usually like aggression or acting out, Is it inappropriate behaviors, nightmares, difficult sleeping, avoiding places or people that remind them of trauma, and difficult learning in school? And the physical symptoms are long-term physical, mental health problem or physical problems. Adulthood, more like tiredness or feeling sick. You can't don't feel like you're feeling motivated and etc. The causes of it is mostly common by exposure to various forms of household dysfunction, such as physical abuse and sexual abuse and emotional abuse, or behaviors that cause harm to a child's emotional well-being. Emotional abuse includes swearing, assaulting, putting down, humiliating, or acting in a way that will make a child afraid of physical harm from a parent. Physical abuse involves with the parent often pushing, grabbing, slapping, or throwing something at the child or hitting the child hard enough. Sexual abuse involves with an adult or a person at least 5 years older than the child, then touching or fondling or touching the child's body in a sexual way. The effects of it when they go to adulthood and current adulthood, especially current adults right now, is mostly higher exposure to ACE has been associated with multiple negative mental and physical health outcomes and leads to an increase in intensity of length and stress response to increase in negative outcomes like neurological, cognitive, and social emotional development in children and adults and mental health in the future. An increased risk of chronic disease, weak immune systems, and higher rates of substance abuse and addiction or drugs that they can feel like is normal, or an increasing risk of suicide. The survey contains 11 questions requiring the specific diagnosis and 7 questions asked about specific mental health related symptoms. According to the data, the responses of this sum to the given total mental health symptoms are diagnosed possible scores are from ranging to mean, because 0 meaning like no mental health symptoms and diagnosed endorsed, to 11 and meaning all, while 11 means like meaning all health symptoms were and diagnoses were endorsed. But since they're just calculating those scores and what the outcomes they would get, based on the graph right now, this is just like an example of what they use for their research. So the results showed that 19.2% of participants experienced homelessness during childhood, but most frequently endorsed ACEs were living with somebody with substance use issues was 71%, parent divorce separations around like 69%, verbal abuse is 61%, emotional neglect is 51%, living with somebody with mental health issues is mostly also like 51%, while physical abuse gold stands at 49%, physical neglect is 41%, and then sexual abuse 39%, domestic abuse 31%, and having an incarcerated member stays in around like 25%. People's point of views are biased. Um, their perception of the public with the perception of adverse childhood experience is mostly complex, being more tendency to blame parents and different views of needed the government intervention, because since parents most of the time are mostly be to blame because due to how they could be living with somebody who had mental issues, or they be never help a child, or just something happens in the future. Also, individuals with AIDS may have difficulty identifying their own emotions and recognizing other points of views. And most individuals who are diagnosed with it may have a hard time to express to what's going on, and also like certain emotions they can go through, and people never get help from them. And also, there's recall biases of when individuals report their own ACE, and recall can be inaccurate, and sometimes inherent biases can affect the reporting process, and people may have different opinions about say things to other people that they've never experienced it, or some people don't get to experience it before. And that's how right now is like a little bit of issue, and same time it needs to be important. It's important to let people know why it's important to see why you're going through. There's other reasons that I did research a little bit. I try my best to find which one does relate a little bit, but it kind of does, but it doesn't mention it. On the article, there's a research about latent class analysis and mental health status amongst Chinese college students being risk of negative mental health outcomes. According to the article, there are previous studies that suggested that being the only child may risk a factor in mental health problems such as depression, anxiety, and suicide behavior among college students, since they've been pressured by parents who had too many expectations on during school and even before college, what they've been through. And is this evidence indicates that social and economic pressures, like a poor family environment, a lack of educational, uh, sources, or low accessibility to mental health services, or left behind experiences may contribute to depression and anxiety and social media among adults too. And there's another article I found that has relations to adults and children and on depression. The other will focus on the mental health issues among children and adults in global major concerns in recent years. According to the article, depression is one of the most prevalent mental health illness among young population, which is common and mostly happens adults around, across the country. And nearly 30% of individuals aged to 10 to 19 experience depression. And this is what my work is. This is all my works cited page. But this is my project, and thank you for listening, and have a good day.